Most think of California's urban cities and beaches. Yet much of California is rural mountains, forest, farmlands, and communities with a small-town feel. Northern California is home to some of the nation's best wildlife, woodlands, and outdoor activities. In spite of this beauty and great quality of life, access to healthcare can be a challenge.
Well, as the economy improves, there are still serious concerns about the nation's healthcare system. Tonight, John Blackstone shows us how the debate is playing out in rural California.
California's far northeast corner is different than much of the rest of the state. There are no crowds here, no busy freeways, pine trees instead of palm trees. And when it comes to politics, this is Republican California, a place where many consider Obamacare a dirty word.
Our patients, they travel long distances and they don't always have reliable transportation. There is no real mass transit system here.
Last winter was hard all over California, all over the West. Bad storms, lots and lots of rain. So for a week, Big Bend was locked in. None of the roads out of Big Bend were passable for a week.
Specialty care, even more so. They have to come from great distances, or our patients have to go to San Francisco or Sacramento, distances and places they're not familiar with.
If Hill Country didn't exist in Round Mountain, for people in much of our service area, it would be an hour to get to a primary care provider.
And that distance brings about unique challenges. But working together is something that makes rural frontier special.
It's essential out in our very rural areas that we are very collaborative with all of our partners, because it's long distances between healthcare providers out there. So if we need to get a patient from one place to the next, we need to have that coordinated.
To address these challenges for patients and providers, one local nonprofit, the Health Alliance of Northern California, is building partnerships to ensure coverage, access, and quality health care.
Our organization is a network of community health centers in 11 rural and very frontier communities in the northern part of California. We have 13 organizations and about 38 sites throughout the region that serves about 138,000 patients.
Delivering health care can be complicated with our fragmented healthcare system. The Health Alliance is working to better organize the local healthcare delivery system and offer opportunities for health system partners to come together to address priority health issues.
Our main goal is to really help support our clinics deliver the highest quality primary care they can. We do this by really working to foster collaboration amongst these providers. Many times, because of these very small communities, these organizations are the only providers of care. So not only the patients, but our staff are professionally isolated.
Hanc also helps to build collaboratives between their members and other key stakeholders. For example, in Shasta County, the local health collaborative is working on key areas such as access, health information exchange, and integrated care.
We have to just try to fill gaps together and figure out where the needs are and try to fill them in a collaborative way. That works the best.
They have improved the quality of care. They've improved people's lives.
Fortunately, in our community, we have an organization like the Health Alliance of Northern California, who is focused a lot on the primary health care system and the federally qualified health centers, but has a strong interest in making sure there is a system that works.
One of the most successful outcomes from local collaboration was organizing around a state effort to bring Medi-Cal managed care to rural areas. Hanc led an effort to bring the county organized health system model and partnership health plan to the region. All involved believed this was the right model.
It was not an easy fight, but because of the relationships that already existed and because of our belief in our right to have them as our choice, a heroic organizing effort was mounted. With Hanc's leadership, we managed to get resolutions from 7 county board of supervisors saying this is what we want in the north, and as a result we have partnership.
I am so impressed with your leadership. I am so impressed by the participants who give so much of themselves for the good of the community.
The major benefit is local control of the monies that are state and federal monies that care for our individual citizens. What I mean by local control is we operate Partnership Health Plan at an overhead or a management cost of around 4%. Our goal is under 5%. We're doing it for around 4%. The monies that are saved with that then allow us to go at priorities in our area, such as homeless, opioid epidemic, access to health care, clinic availability, these types of things.
Partnership Health Plan has been a great partner with the collaboratives to execute these community health improvement initiatives.
We looked at another opportunity to create a kind of a larger collaborative, and that was called the California Community for Rural Health Improvement. There was an opportunity, again, to virtually connect everyone, to spread best practices, share ideas, share challenges, and that's been very successful.
The California Community for Rural Health Improvement proved necessary when the area's Medicaid expansion was threatened. A strong voice for rural areas was needed more than ever before. Hanc convened healthcare leaders to discuss what these changes could mean for rural communities and used this community input to advocate the importance of the Medicaid expansion for the region. Small rural communities are stronger when they link arms to improve health.
It's very helpful to have a sense that we're part of something bigger and to increase the power, essentially, of our rural community.
Northern California may have its challenges, but the power of rural is relationships, collaboration, and collective impact. By working together, a better healthcare system is possible for all.